everyone. Welcome to the Healthy Go-Getter podcast. Today we have Brooke to be our guest today. So actually we're talking about a lot of lady experiencing with a pelvic floor dysfunction, but a lot of times they don't know. So I'm so glad to having Brooke to come in to share your experience, and so that we can be able to learn from you. So Brooke, can we start with you? Like, what make you become a physical therapy first?
That's a good question. A lot of people ask me that. I have always been interested in like the human body, so how it works, um, muscles, bones, how it moves, that all that type of thing. I've always been interested in the medical field as well, so kind of put those two together and decided to go to PT school. And then I've also always had an interest in women's health, and so in PT school we had, this was 17 years ago now, but we had like an hour lecture on pelvic floor physical therapy because it wasn't as well known back then, and not a lot of people were doing it. But and it also has changed a lot since then as well. But I thought it was really interesting, and I decided I wanted to specialize in that as well.
Wow, that's a long time ago, right?
Yes.
That's amazing. Yeah, I can't imagine just one class change it,
Yeah.
change
Yeah.
it. Yes, that's amazing. That's amazing. So, why do you think pelvic floor health is something more women need to understand?
I mean, I think it's really important because it's the base of your spine. I mean, it's kind of the center of your body, and
Mhm.
it works with so much of your body. It basically, like, head to toe can affect your pelvic floor, and your pelvic floor can affect head to toe. So it's not just if you're having urinary leakage or if you just had a baby. Those things definitely can be addressed with pelvic floor therapy, but there's so many more things that it affects and can affect it as well. So a lot of people think that they have to live with, urinary continence or pelvic pain or the pressure because they're getting older or they just had a baby or that's just what happens to women. And I think it's really important to know that while those things are common, that they're not quote unquote normal, and you don't have to live with them.
Got you, got you. I know that that's a pelvic floor dysfunction applies to males too.
It does.
It
Yes.
does apply to
Yes.
males too.
Yep.
Ooh,
Yeah.
okay.
Everybody has a pelvic floor. And kids as well. Kids have pelvic floors and they sometimes have dysfunction, not as much as adults, and obviously males not
Wow.
as much as females because they don't have babies, which is, a big factor in pelvic floor dysfunction. But yeah, I treat males and kids as well. So
Oh, okay, okay. Let's get in the male out of the picture
yes,
today.
we're talking about us women.
Yes, yes, yes. Hey, we honor the Mother's Day month, right?
Yes,
So
yes,
Women's Health Month, especially for mom today. Yes,
yes.
yes, that's awesome. So, luckily that I have some notes, so I'm just asking the professionals questions,
Sure.
and then you just answer whatever
Yes,
coming up
yes.
your mind. How is that? Okay.
Yep.
So. I know that in prior to the podcast recording, you gave us a presentation that was amazing to understanding all more about pelvic floor. So for some of our audience that who has not watched the presentation, then I will just ask them some basic questions. You just
Sure.
help us to answer again. How's
Okay,
that?
sure.
Okay, so um, what exactly is the pelvic floor and what does it do?
Okay. Yeah.
Mm-hmm.
So the pelvic floor, actually, with this little model here, you can see it's at the bottom of
Yes.
your pelvis. It's a group of muscles that forms a sling or like a bowl um, at the bottom of your pelvis, and it works with your other core muscles. So your back muscles, your abdominal muscles, your diaphragm, your hip muscles as well, kind of play a role as well in core stability. But it helps with maintaining continence. It helps with pelvic support, supporting the organs. Um, it helps regulate pressure and breathing. Um, your pelvic floor has to relax in order to have a baby. So relax and lengthen in order to have a baby. It also, some of the more superficial muscles help with sexual function. It also helps with pumping fluid and blood back up into the thorax here so that your lymph system can get rid of toxins. So it does a lot. The biggest, I think, the the more common thing that people think pelvic floor does is um, keep you continent, so keep you from peeing your pants, right? Which that is a big one. But it also has many more functions.
Got you, got you. So what are some signs women experience that might actually be the pelvic floor dysfunction, but they think, oh, that's just something that I feel maybe that when they go to the doctor, they think about that they have a UTI, but in fact they are not. They
Yes.
just constantly feel like stomach pain, but they
Mhm.
doesn't know. So what are the common symptoms might showing as a pelvic floor dysfunction, but how many people that didn't know?
Sure.
Mm-hmm.
So when you're talking about, say, you feel like you might have a UTI, there are
Mm-hmm.
a lot of people that have think they have a UTI because of that kind of like the burning and the frequency and the discomfort there. Um, and sometimes it is a UTI, but if you've been to the doctor and you've had a urinalysis done and it's been negative, so there is no UTI there, that can actually be a symptom of pelvic floor tension. So that tension, the
Mm.
muscles around your urethra and the bladder as well, can be tight and cause that kind of burning sensation or urinary frequency, feeling like you have a UTI. That can come with, all of the things that cause pelvic floor tension: stress, constantly like different postures that are putting your pelvic floor in a tense position, um, uh, issues with um, different medical issues. So a lot of people with like hypermobility syndromes,
Mm.
to try to, their body kind of subconsciously tenses up to try to help stabilize that area. So there, a lot of people with like Ehlers-Danlos syndrome, they come in, which is hypermobility of your joints. They come in
Mm-hmm.
with tension typically because they're
Mm.
constantly tightening those pelvic floor muscles up. But some other things like just the typical like urinary incontinence, constipation can be a symptom.
Mm.
If you've changed your diet and you're moving and you've increased your fluid intake, all of the things that they tell you to do to increasing fiber, that type of thing, to decrease constipation. If those things aren't working, it might be because your pelvic floor muscles are not relaxing in order to have a bowel movement. So things like that, increased pressure in the pelvic floor or the perineal area in between your legs,
Mm-hmm.
just pelvic pain in general can be pelvic floor dysfunction. So
Mm-hmm.
there are many symptoms that can be related to pelvic floor dysfunction.
Wow. Yeah, that's basically it's the base of your body,
Yes,
right?
yes.
Yeah. So I can see that. So who have you seen most for your patients?
Um, Probably, I would say women that are pregnant and then postpartum are a big make up a big part of my patient
Mm,
population.
okay.
Also, a lot of women that are like perimenopause, menopausal as well, because with hormone changes they get that those urinary symptoms as well, like incontinence, and that frequency and urgency, that type of thing. So those two probably make up the biggest portion, but there are also a lot of people with just chronic pelvic pain as well. So those
Okay.
three are probably the biggest categories that I see.
Okay, okay. Yeah. I'm glad you asked this question. We next one we're talking about actually talking about the pregnancy and the postpartum. And then a lot of time when clients come and get a massage, especially pregnant massage
Mm-hmm.
and then also postpartum massage, we've heard a lot of clients they having like pelvic floor dysfunction or they
Mm-hmm.
feel pain on their hips, they feel pain on their pelvic region area, because the baby in there, so they trying to expanding, trying to
Right.
get it out. So there is a lot of dysfunction right there. So how about we starting with before the pregnancy and then during the pregnancy and then after the pregnancy. So
Okay.
let's start with the before first. Okay.
Okay.
So common question that people are asking most frequently is like, if people have pelvic floor dysfunction, ladies,
Mm-hmm.
that they didn't have a pregnancy, but with that gonna impact their conceive to getting pregnant.
It can.
Mm.
I have seen several patients that have pain with intimacy or pain with intercourse. And so, um, obviously, that is what needs to happen in order to conceive if you're conceiving in that way. But we can work with you to work with patients that have that issue. And typically that's due to pelvic floor tension.
Mm.
So we work with them to, we do exercises for relaxation, breathing exercises to lengthen and relax the pelvic floor muscles, but also we can do manual therapy too, I mean, depending on what we find in the evaluation, but to decrease tension in those pelvic floor muscles.
Okay, wow, that's amazing. So it really does.
It can.
It
It
can,
can.
right? It
Yes.
can.
Yeah.
Okay, okay. So hey, for some of you, if you experience that, definitely come to see
Yes.
Brooke, right? Yes, yes, yes. Okay, so uh, so next question would be, how does the pregnancy and the birth change for the pelvic floor in the body?
How does it change the pelvic floor
When you
when you're
having the
pregnant
baby? Yes.
and delivery? Yeah.
Uh-huh.
So with pregnancy, it changes your posture, obviously. So
Mm.
with the growing baby, I mean, it's putting a lot of pressure down on your pelvic floor,
Mm-hmm.
but your center of gravity kind of moves forward, right? And so a lot of times we get like an anterior pelvic tilt. So we're kind of tilting our pelvis forward because of that weight in the front. And then you get more back pain
Mm-hmm.
and strain on those back muscles.
Mm-hmm.
Sometimes people kind of try to counteract that, or they already have a posture that does not go into that anterior pelvic tilt, and then they get more of like a high. It's called a high hinge point up more in the mid to low or mid back, upper low back, and so that can cause pain in the a little bit higher up.
Mm-hmm.
Pregnancy puts pressure on the SI joint. So the pelvis has, a joint in the front here. It's your pubic symphysis, and then the two SI joints in the back.
Mm-hmm.
And that can, as the baby grows and hormone changes to allow the pelvis to kind of expand during delivery, that can put strain on those joints. Um, and then with delivery, I mean, you can have some tearing of
Mm.
muscles, soft tissue in that area. You can have, some injuries to like tailbone, or you can have like a pubic symphysis separation, so that joint in the front can separate. So there's some birth injuries that can occur. But even if you don't have a birth injury, I mean, vaginal delivery is it's hard on your pelvic floor.
Yeah.
Those muscles have to relax. And I mean, women have been having babies for a really long time, right?
Uh-huh.
But I think, just in the last 10, 15 years, we've come a long way in like being able to prep a little bit more for birth, prep that pelvic floor a little bit more for birth, and that's one thing that I do. Also, if even if you're not delivering vaginally, that C-section,
Oh yeah.
that's a major surgery, and I think a lot of
Mm.
people don't realize that. It's honestly it's the only major surgery that women have, and then they're expected to go home soon after and take care of a little baby, and
Oh,
so
okay.
it's a big deal. So
Mm.
um, even though you're not delivering vaginally and you're not putting, those pelvic floor muscles through a vaginal delivery, they still can have dysfunction from pregnancy itself. But then
Mm.
also when you have a C-section, you're going to have a scar here. You're going to be guarding because it's not comfortable. So that coordination of your pelvic floor muscles with your abdominal muscles and your other core muscles can be dysfunctional as well.
Wow. In China, when you have a C-section, you will stay in the hospital over a week before
Really?
you leave.
Yes.
Yeah.
Yeah. Other
Well,
countries I think they're much more, they take care of their women a little bit better
yes.
than here in the United States. I mean, in Europe, pelvic floor physical therapy is like it's like ordered for every woman that has had a baby. Here,
Wow.
some doctors will order it for you, but typically you have to ask for it. It's not just like it's a given. Yeah. And
Wow. Okay.
insurance, I mean, typically now here, insurance does cover it. But like there, it's just included. And
Mm.
I mean, it's just part of the protocol basically.
Mm-hmm.
But here, most patients have to ask for it.
Mm.
I think
Wow.
doctors are getting a little bit better at noticing things and saying maybe pelvic floor physical therapy might help you, but typically it's the patient that's advocating for themselves.
Mm-hmm. A lot of time, the doctor, if they didn't have the training like you had within an hour course, tell you when you're in the medical school, they might not have the knowledge
Right,
on that,
right.
right? It's
Yeah.
just really depending on how much
Yeah.
training
I
they
mean,
have.
yes. And obviously OBGYNs,
Mm.
doctors that are delivering babies and taking
Oh,
care of
yeah.
pregnant women, they have extensive training, but just not the rehab side of it. And so, when I was in physical therapy school, that 1 hour pelvic floor um, uh, lecture spurred me to become a pelvic floor therapist, but I took a lot of continuing education to get certifications and become a pelvic floor physical therapist. So it was, it's a lot. It's a lot of education. It's always ongoing with
Mm-hmm.
new research coming up as well or coming out as well. So you stay up to date with everything that's developed throughout the years because when I first started doing pelvic floor therapy 16 years ago, it
Mm-hmm.
was different than it is now.
Oh, what is the difference?
It was more kind of just let's just look at the pelvic floor by itself and
Oh,
just
okay.
treat that, and it
Okay.
wasn't like bringing in everything. It
Mm.
wasn't bringing in the nervous system typically. It wasn't bringing in pressure management and all those types of things. So it just
Mm.
basically was a lot of let's strengthen. And now it is some people need strengthening, some people need relaxation, being able to
Mm.
relax those pelvic floor muscles first before we strengthen. And then also it's more like global strengthening now and functional strengthening rather than
Mm.
just let's teach you how to do the Kegel and
Cold
send you
good,
out the
right?
door. Yeah. Yeah.
Okay, okay. Wow, wow, wow. It's the thing is like gradually developing, progressing,
Yes.
right?
Yeah.
Yeah, yeah.
Yeah.
Wow, wow.
Which I mean, a lot of that's what medicine is. We're always, there's always new research coming out. So
Mm-hmm.
luckily we are on that track as well. So
Mm-hmm. I really hope that we can push massage a little
yeah,
more
yeah.
on that because like a lot of time people didn't realize how much this massage really helps.
Mm-hmm.
Yeah, so I
Yeah.
wish that we have those more like studies, research, and then working in this profession and make it
Mm-hmm.
more like make all of the therapists can be go through more medical training and then be more knowledgeable on everything so
Right.
that can be able to providing best the service for the client.
Yeah,
Yeah,
absolutely.
yeah, yeah.
Yeah.
That's amazing. That's great to hear that.
Yeah.
Yes, that's awesome. Awesome. Um, so what about the postpartum? What are some common postpartum issues women think are normal but actually should be addressed?
I think incontinence is a major one. So the
Mm,
urinary leakage.
mm,
That is, I think, we have pads that, I mean, there's a big market out in the store, for pads and commercials for pads and that type of thing. So just wear a pad and, you'll be good. Um, because you've had babies and you're getting older and but really that it is a very common thing. Urinary incontinence is a common thing, but again,
mm-hmm,
it's not normal, and you shouldn't have to deal with it. So that's one big symptom that they have typically. A lot of times, there's also prolapse. So that prolapse can come from pelvic floor weakness, also pelvic floor tension. It could come from like a birth injury as well. So you can have some of the muscles that attach here. So they're called the levator ani. You can have a levator ani avulsion, it's called. So it can like tear off the bone.
Wow.
And sometimes people don't even know they have that. And so then obviously your muscles are not going to function. You're not going to be able to contract. I've had many patients come in with, very minimal pelvic floor contraction, which that can be normal. Right after having a baby, those muscles need to recover and they need some training to get back to normal. But yeah, I would say prolapse, urinary incontinence, and then just pain also after having a baby. So back pain, SI joint pain. So this pelvic girdle here with the SI joints and the pubic.
Can we turn this one right here so they can see it?
So SI joints here, and then the pubic symphysis in the front. That's all called like pelvic girdle, and so you can have pelvic girdle pain, and that's another big one that people see, or that I see with people coming in after in the postpartum time. So it's a lot of stability, coordination of core issues to help keep that pelvis where it should be.
So I've seen quite a few clients of mine that they were saying like when they have the delivery of the baby, I don't know what, it's very hard for me to pronounce that injection. So whenever they had the injection and then they deliver a baby, what is that called?
Epidural.
Epidural, yeah. So they were saying like whenever they had the epidural, and then after that they just constantly feel like lower back pain, or they have like sciatica shooting down and everything like that.
Yeah.
So was that
sometimes I think sometimes there can be an issue with the epidural. It can cause some dysfunction, I guess. But I think typically people kind of correlate that together, or think the epidural is causing their back pain, which is not typically the case. It's most likely due to just those core muscles. So pelvic floor, abdominals, back muscles, everything is now different again because your posture changed again, because now the baby is not there anymore, right? The baby is outside of you. And so it's just your body kind of reacting to that change in posture again. So a lot of times it's not technically the epidural that caused it. Like I said, there can be issues with epidurals causing chronic back pain. But typically it's most of the time just that core pelvic floor. We need to work on that to be able to provide stability, to provide support for the spine and the pelvis.
Okay, so let me just speak to some of my clients, right? So let me turn this one face to you. Okay, so they are feeling probably should have still showing on the camera right here. So what they feeling is like they feel like they are like SI joints right here, close to the tailbone area right here, and then all of the muscles around here in the glutes area is being tightened. It's very tight, and then also the lower back muscles right here is starting getting tight. Is that something is like in considered as a pelvic floor region that they should go to see you if they are always in pain, anything like that, or what does that looks like?
Yes. So it can be because these muscles are constantly overworking because there may be weakness in the pelvic floor or lack of coordination of pelvic floor with those back muscles, with those hip muscles, those glutes. So it can be due to postural issues. It can be due to weakness. It can be due to tension. It can be due to sometimes there's nerve involvement there. So it can be due to many things. So being evaluated by a pelvic floor physical therapist is a good idea. I think postpartum that I honestly think we should adopt the whole European method and kind of give everybody pelvic floor, or at least a screening.
For sure.
So that they can, determine if you need pelvic floor therapy, or, give you some exercises to start with and see if those help, that type of thing. So I actually have a really strong feeling about that. So I actually offer a 30-minute free consultation, like screening for
Oh,
all postpartum
really?
women. Yeah,
Wow.
yeah.
Okay. Yeah,
So it's not
that's
a
awesome.
it's not a full. Usually my initial evaluations are an hour and a half long. So my first
Mm-hmm.
visits with patients. So the screening is 30 minutes. So it's just basically kind of looking at what they want to look at, what they want me to look at, what their issue is. And we do kind of a screening so I can tell them, yeah, you probably are a great candidate for pelvic floor physical therapy, or maybe if they have like an avulsion, elevator anti-avulsion, maybe you need to go back and see your OBGYN, that type of thing. So just having somebody that's trained specifically to look at your pelvic floor um, is a good idea to do after having a baby.
Mm-hmm. So, like from the time frame, like when would be the best time for them to participate in that screening?
So, I mean, you can do it as soon as you are comfortable. I typically see people from like 4 to 8 weeks after
Oh,
having
four
a
to eight
baby.
weeks.
Yes,
Okay.
yeah.
Okay.
Most patients come in after they've gone to their 6 week postpartum check,
Mm-hmm.
because I mean, it's great, fine to give your body a little bit of time to kind of snap back or to see like where you're at after
Mm-hmm.
a month or so.
Mm-hmm.
But you can come in as early as 2 weeks. We're not going to be doing anything extensive or aggressive in those 2 weeks, but just I start with a lot of breathing with people. I start with breathing with everybody, but with people that are like very newly postpartum, typically
Mm-hmm.
they'll, like I said, it's anywhere from like 4 to 8 weeks
4
postpartum.
weeks.
Yeah.
Okay. So when will be considered the postpartum is done? Like when you call that one is end?
So I always say once you're postpartum, you're always postpartum.
Always
Because
postpartum.
you can
Okay.
actually, like, if you had a baby 15 years ago and you
Okay.
still have issues, you can still improve those issues. But
Okay.
typically it's like a year to 18 months.
Year to 18
Yeah,
months,
yeah.
right? No,
Year to year and a half.
Let's keep it forever. Just remember that whenever we have a postpartum, it's always postpartum.
Yes.
Okay. So yeah, so that's really good to know that for me, I was in China after you have a baby. So basically you have in a month. In a month, like all the family member were taking care of
Yes.
you. So the lady will stay home,
Yes.
not doing anything. The family member were taking care of the babies and everything for a whole month.
Yes.
So they don't do much.
Right.
But like when I came to here, I was, what? You guys already walking, holding the baby like this?
Oh yeah, yeah.
Oh my
yeah,
gosh.
Yeah.
Yeah.
I mean, they give you like a, you know, don't lift more than what your baby weighs restriction for like 6 weeks with a C-section. But other than that, you're pretty much good to go. And then when you have your 4 to 6, they do it sometimes at 4 weeks, but 4 to 6 week postpartum checkup, unless you ask them, they won't do, typically, some doctors may, but in my experience, they don't do like an actual exam on your pelvic floor or internally or anything like that.
Oh,
so
really?
unless you're having issues, they're usually like, yeah, you're free to resume exercise, you're free to resume intercourse, you're free to, and all the husbands, of course, are happy with that. But you can do whatever you want, which if you feel like you can do whatever you want, that's great. But I think a lot of women are like, I don't feel like I can do anything I want to. And, they feel like maybe they'll hurt themselves or they're in pain and they can't and don't want to. I think, like I said, I think having a postpartum check is pretty important.
Yeah, we're definitely gonna let more people know about what you offer.
Yes.
Yeah, whenever you stop, let us know too.
Yes.
Okay, so you don't pile up all of the appointments.
Also, another issue that women usually have with postpartum is a diastasis recti, which is a separation of their abdominal muscles.
Yes.
And that's due to, obviously, baby has to have room, right? So most women do have at least a little bit of that separation. And some women, it kind of goes right back. Some women need help, a little bit of help with that. So That's another common thing that I see after postpartum, after
Oh,
pregnancy and
okay.
delivery as well.
Okay. Awesome. Awesome. That's great to know.
Yes.
So we will definitely make a notes, and whenever I have clients having those issues, we'll definitely refer your way for
Yes.
sure. This is very,
Awesome.
very helpful. Yeah. So now we go through pregnancy, we go through the postpartum. Let's come into the menopause.
Okay.
That's something like people don't know a lot of time. Like it was, oh, I'm already having menopause already,
Hmm.
So, um, like I think one time I was in the health and wellness summit,
Hmm.
and they did invite a hormonal doctor,
Yes.
and then they were talking about the menopause. I was like, what?
Yes.
I was just like, wow.
Yes. Yeah.
Yeah. It's the same thing. Like once you're menopause, you from the time that you have a menopause, it's menopause forever. So the husband needs to be understanding that too, right?
Yeah, I mean, menopausal or perimenopausal menopausal symptoms can start, I mean, for some people in their like late mid to late 30s.
Mm.
I mean, most of the time, like menopause, it's typically like 48 to 51, 52, in that realm.
Mm-hmm.
Um, but hormonal changes can really affect your pelvic floor. They can cause symptoms. So decreased estrogen can cause those symptoms of like UTI feeling, um,
Mm.
because the tissues get a little bit atrophied and drier. So that hormone change can cause issues there. You can get more joint pain because of declining estrogen, decreasing estrogen. And your bladder actually can be affected by the decrease in estrogen too. So it's less kind of extensible, and so it doesn't empty as well. Those
Mm-hmm.
types of things. So those hormone changes can really affect your pelvic floor.
Mm-hmm. Yeah, I think for some reason, whenever you say pelvic floor decrease estrogen, I would think about, oh, frozen shoulder. That's another one
Oh
too. Like,
yes,
yeah, right.
yes, absolutely.
Yeah.
Yeah, yeah. A lot of like glute tendinopathy and frozen
Mm.
shoulder that occurs in menopause as well. Perimenopause,
Mm-hmm.
menopause. Yeah.
Yeah, very common.
Yes.
Very common.
Yes.
Wow. Okay.
Yep.
Yeah. So, what has like menopause will change the pelvic floor then? Like, what does muscle really change it too after the menopause? Like, what
Yeah,
that
I
looks
mean
like?
that, like I said, the tissues kind of can atrophy. Your muscles can become
Mm.
weaker.
Okay.
So you have less support there. You can have less sensation, like with
Oh.
sexual function,
Okay.
that type of thing. And again, with those urinary symptoms. So it's called genitourinary syndrome of menopause,
Mm.
GSM.
Mm-hmm.
You can also have that with like postpartum genitor genitourinary syndrome of of um, pregnancy or postpartum as well. So anytime you have hormone changes, you can get bladder symptoms or urinary symptoms.
Oh,
So
is that including puberty too?
sometimes,
Sometimes.
yeah,
Okay.
sometimes teenage girls have issues with that as well. Yep, yeah,
Hmm. Okay.
or
Yeah.
younger. I mean, it starts at 8 now with some girls. So
What?
yeah,
Wow, that's too
it is
early.
very early.
Oh my
Yeah.
gosh. Wow.
So
Okay.
yeah.
Yeah, for sure, for sure. So, what do you helping people with menopause whenever they come to see you?
So same thing. I mean, we work a lot with doctors in because as a physical therapist, I cannot prescribe medication, and so um, a lot of times I will have them like go see their doctor and tell them about their symptoms and see if they can maybe um, get their hormones addressed by using. A lot of times they use like uh, topical estrogen, so
Mm,
outside the body. A lot of people are kind of afraid of like hormone replacement therapy
mm-hmm.
because it got a bad rap way back in 2002, I believe. With it said that it increased breast cancer, really didn't. And so now I think we're talking about it more, and people are becoming more comfortable with it. But topical or vaginal estrogen can actually help those symptoms as well. So
Wow.
use that in conjunction with pelvic floor physical therapy, with learning how to relax the pelvic floor or get the pelvic floor to coordinate better and increase blood flow to the area for like sexual function issues. And then also just looking at that musculoskeletal kind of screen with joint pain, that type of thing,
Mm.
posture, body, biomechanics, lifting mechanics, that type of thing. So, I mean, it's basically the same thing. Um, we're just, in a later stage of life. And so sometimes you need a little help with some hormone regulation, or adding a little bit of hormone back or a little bit of estrogen back, can help as well. But
Mm.
it's just basically, I mean, it's tailored to each person. So, but looking at how their pelvic floor functions and what they need.
Mm. Wow, wow, that's amazing. That's amazing. So when you're talking about posture, I have another thing that I want to add in. Is it okay? I'm adding another section
Sure.
of it. Okay. Get out of the plan, right? Okay,
It's
yeah,
okay.
yeah, yeah. Okay. Okay, so when you say like posture related, do you see people who have more anterior tail that cause more pelvic floor dysfunction, or more like posterior tail that you see more?
Both.
Both?
Yeah. Yeah.
Oh, okay.
A lot of people that have that are kind of like glute clenchers or butt
Mm-hmm.
tuckers,
Mm-hmm.
they have that posterior tilt and they're kind of tense and tensing everything up.
Mm-hmm.
Um, People that have more of the anterior tilt, like their hamstrings are lengthened, their hip flexors can be tighter,
Yeah.
um,
Mm-hmm.
that type of thing, and then it kind of throws off that balance of pelvic floor as well. So either both ways, I see both of those things.
So it's pretty equal.
Yeah, I
Pretty
would say,
equal.
yeah,
Oh,
yeah.
okay. Okay, that's very interesting. And actually, recently I just working with a gymnastic, a
Oh yeah.
competition,
Okay.
and he said that like his mom tell me that he won, like not like gold
Right.
something, but he's like go up to five,
Okay.
in the five place nationally, and then fourth place nationally too. I don't know which one was, but uh, I was wondering, like, whenever people who does a gymnastic, whenever they doing all of the flips, they do
Mm-hmm.
all of the things, like they landing with their feet down and then jump really high. With those type of competition, would that impact a lot on their pelvic floor dysfunctions
Absolutely.
too?
Yeah.
Yeah, pelvic
So
floor.
gymnasts, dancers, um, runners, I
Mm.
mean, really any sport, you can see that has a lot of impact, can see pelvic floor dysfunction. There's a lot of, you know, young girls, and I mean, this can happen with men as well. But there's a
Mm-hmm.
lot of young girls that have like urinary incontinence already,
Oh,
and they have
really?
never, they've never had a baby. They don't have the typical, things that go along with what you think should go along with that urinary incontinence. But that impact and inability to control pressure. So typically it's them like pushing pressure down on the pelvic floor with their sport. Okay, so
Mm-hmm.
um, a lot of times with dancers, they are, their posture has to be like,
Up high.
upright, and they're constantly gripping their abs or their glutes, in ballet, they're always like externally rotated, and so they have tight hip rotators,
Mm-hmm.
and that can definitely kind of affect your pelvic floor as well. One of your hip rotators sits on top of your pelvic floor. It's called your obturator internus
Mm-hmm.
here, so it
Mm-hmm.
kind of goes with kind of right on top of that pelvic floor. So it's a hip external rotator.
Mm-hmm.
So sometimes if those are tight and short, that can definitely affect your pelvic floor function as well.
Mm.
So yeah, athletes, there are many studies out there, with athletes and pelvic floor dysfunction.
I can see that. I was looking for their flips and jumping,
Yeah.
landing. I was like,
Yes.
this is so much on their SI joint, because when he is coming, a lot of the pain and tension is on SI joints,
Okay. Yeah.
So the QR was really tight
Yeah.
and everything. So I was like, okay, this is a lot. I was like, okay,
Yeah.
people need to be aware of
Yeah.
that. Yeah. Mm-hmm.
And gymnasts, especially, and dancers as well, they tend to be more hypermobile. They have more range of motion, right? Either
Mm-hmm.
they've trained their body that way, or they just, were born that way, and they've kind of, you know, figured out like dancing, and I can do dancing and I can do gymnastics because my body is this way.
Mm-hmm.
But that, I mean, that puts a lot of stress on your joints, and then your muscles, in order to try to stabilize and keep that support there, can work overtime and cause tension.
Mhm. So for those people who have like hypermobilities, what do you recommending them to do? Do they need a more strengthening or they
Yes.
more need a like I know that for me, when people come in with a massage, I always saying that if you have hypermobile, don't stretch it, strengthen it.
Yes. I mean, typically that's what we recommend is strengthening,
Strengthening, yeah.
stability, that type of thing. Um, but again, when say your pelvic floor, or any muscle really, if it
Mm-hmm.
has tension in it, you need to be able to relax that muscle and fully lengthen it to get it to contract optimally as
Mm-hmm.
well. So you do need to work on relaxation as well to get a good contraction of a muscle.
Mm-hmm.
So we work on both things, but typically, if you want to, kind of put that hypermobility in like a box and say, what do you need to do? Yes, strengthening stability is a big
Big
thing with
thing,
them.
right?
Yeah, for
Mm-hmm. So
sure.
you don't like over sprain
Right.
anything, right? Mm-hmm.
Yes.
In the joints. Okay, that's awesome. Let's get back to the track. Thank you, thank
Yes.
you. Yeah, thank you for letting me ask more questions. Okay, so, um, so now let's talk about like practical helps, right? So how, what are the simple things that women can start doing now to supporting their pelvic pelvic floor health?
So if they don't have any symptoms at all, are you saying?
Yeah, if
Okay.
they don't have any
No
symptoms.
symptoms. So I would start with just overall like core strengthening, honestly.
Mm.
So we talked about pelvic floor is at the bottom of your core, and then you got your abdominals and your back muscles and your diaphragm. So core strengthening, overall functional strengthening, and then also breathing. So
Mm.
deep diaphragmatic breathing, 360-degree breathing, we call it, um, just to kind of get your pelvic floor to relax and then contract. So if you're not having any symptoms, I would say, continue with, your normal exercise that you find effective for you, but add some breathing in and add some more functional kind of global core strengthening.
Mm-hmm. Well, for someone who has mild syndrome, what do you recommend them to do?
Um, Depending on what the symptoms are,
Okay.
I think, I mean, honestly, I'm going to say this because I'm a pelvic floor physical therapist,
Yes, yes.
but I think just being evaluated, honestly, and just, seeing what do you have to work on, what could I help you with? Again, I could see you for a visit and just say, work on these. I would work on these things for a little while. If that's not helping, come back and see me. We can, change it up a little bit. But
Mm-hmm.
if, those mild symptoms are not going away and you've, tried other things, I think seeing a pelvic floor physical therapist is a good way to go.
Mm-hmm. I'm with you. I'm with you. Like as a massage therapist, I always say, hey, I don't recommending, so most of the time I need to see how is your muscle
Right,
going. And a lot
exactly.
of times
Yes.
it's like it's not only one part of the muscle has a problem, it's like all over. So you need to
Yes.
see the
Yes.
global
It's
pictures of
yes,
you.
exactly.
Yeah.
It's not just pelvic floor. I need to see like what's contributing to it, right?
Yes, yes.
Or it's not just incontinence. There could be other things going on. So
Uh-huh.
again, like you said, evaluating. You need to see somebody in person. Typically, is the best
Mm-hmm.
way to go,
Mm-hmm.
just so they can see what is going on and give you a kind of a plan of action.
Mm-hmm. I'm with you. I'm with you on that. Yes. Um, so yeah, that's is very, very helpful. And then I think this is very, very helpful for people who are learning about pelvic floor, which is like anatomy proportion of it. We are talking in the presentation. If you haven't seen that, definitely looking at our YouTube channel, you can looking at the presentation prior to the podcast as well. This is great information. I think all of our audience can learn so much from this. So do you have anything else you want to talk into our audience?
Um, I think just knowing that even though things are common, like I said before, they're not technically normal, and you can get help for it. You don't have to live with it. I think. I mean, I've seen so many like posts on moms groups or heard comments, overheard comments of moms or women in general, like, oh yeah, I can't jump on the trampoline with my kids because I pee my pants type of thing. But oh well. Um, but you can do something about that, and you can come see me or see somebody that is trained in pelvic floor therapy or evaluation. But I would be happy to help. And again, I think not just knowing that you don't have to live with that, you don't have to accept it, and you can get help for those issues.
That's amazing. So, how can people find you though?
You can go online. My website is www.conkinpublichealth.com. I do have online booking as well, but my website gives you a bunch of information about what I do, my training, that type of thing. And then you can go directly to my booking page. And then my office is in Edmond, off of Bryant, in between 15th and 33rd Street. It's kind of tucked back in offices back there, behind Acreview Pet Hospital. And you can also call me, 405-888-1852, and I'd be happy to discuss anything. I also offer, in addition to like the free 30-minute screening for postpartum moms, I do offer free 15-minute discovery calls. So like if somebody wanted to just call and talk and see if we're a good fit, there's free 15-minute slots that I can do that too as well.
Can we repeat the phone number again? Slow this up. I follow you. Okay.
405
405
888
888
1852.
1852. There's a lot of eight.
I know.
Yeah, in China, 8 is good.
Is
You're
it?
gonna have a lot of money.
Awesome.
yes. Okay. Thank you so much for joining with us today. And I learned so much. I taking a bunch of notes, and then I think I will prepare for this whenever if we planning to have a baby, and then after maybe I should just go see Brooke to prepare everything. Yes.
Yeah, you can definitely come and see me prior to pregnancy and just see if there's anything you might need work on beforehand. Yeah.
Probably gonna be better actually, right?
Yes.
If I see you better, I see you definitely gonna be better. But I'm just like, if I see you beforehand and then during and then after, I think that's gonna be important.
Yes. Yeah. Better recovery, better prepared for birth, better recovery after birth. So
yes, most definitely. Hey, if you're preparing for this, definitely go to see Brooke. Thank you guys so much for coming. Thank you guys so. I can't say it right. Okay, thank you guys so much for watching or listening on our podcast. And if you are interested in to learn more about the episodes, please subscribing our YouTube channel and then review us on Spotify and Apple. We will see you in the next episode.